welcome to the Flourish Community Podcast. Such an honor and a privilege, honestly, to be here today. My name is Sibongile Mpongwana-Ncethani. I go by the name Sibo. Some people call me Dr. Sibo. I'm a psychiatrist and I am the host for the Flourish Community Podcast. Here we believe that faith and mental health can walk together. Faith and psychiatry can be integrated towards wholeness and wellness so that you can really live a flourishing life. So, thank you for joining us today. And I want to also just say, if you haven't subscribed to this channel, please, what are you waiting for? Please subscribe, please share with your friends. Our main aim here, my role as a psychiatrist here, is not to make a diagnosis or to bring any treatment, but it's purely educational. And I want to caution and say, please take whatever you hear here and engage in conversation with your treating mental health care practitioner, because there's no way I can give advice to you without knowing your full context, right? So, but these are conversations, these are questions you can ask yourself, these are questions you can engage in with your therapist or your psychiatrist as you move towards your own journey of healing. Hopefully this is information that will challenge you, information that you will take and run with, and be like, I haven't yet done that. Do I need to do that for myself? Okay, so I highly recommend that you see someone and you get to be seen in your own context and given the proper treatment. Okay, so having said all of that, thank you so much. I really enjoyed your responses to our previous episode on, it was called, guys, do you want to be well? What a rich question, right? I think what really stood out for me is the things that sometimes stand in the way of our healing, right? Like we want to be well, or it's a reflex answer, like yes, of course I want to be well, but we don't really sit in that question and think, but why am I not well? Why have I been pursuing this healing for so long and still haven't sort of like gotten hold of it, right? So as a follow-up through to that, I'm having a solo episode. If you've been a listener of this podcast, guys, since 2021, okay, we were on and off, but come on, we're here. And you will know that I really love sitting and having conversations with people. But I just decided, let me have another solo episode for you and sort of teach you or inform you, give you the facts on as a follow through to the previous question that we asked on wanting to be well, and ask the question, what does it really mean to be well? What really happens in your first psychiatry appointment, and why you don't need to be afraid? So I'm talking about seeing a psychiatrist. So you've answered the question, yes, you want to be well, and we're talking about mental wellness here, and we know there is no mental health without physical health, right? So but you recognize that something is not right with your mental health, and you've decided you want to see a psychiatrist. So what really happens in your first psychiatric appointment, and why don't you need to be afraid? Because a lot of people are afraid of seeing the psychiatrist. Okay, so this is where we're going to start, my friend. We're going to ask ourselves, what is psychiatry? Okay, that might sound like a very elementary question, but a lot of people do not know. So remember, psychiatry is a branch of medicine, right? And their focus here is on diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders, right? So that is what we do. We treat, we diagnose, we assess, we come up with a particular diagnosis, and then after that we're able to say, okay, this is what you can do to prevent yourself from getting more ill, this is what you can do to get better. So usually if you are ill and you go see a psychiatrist, you will be seeing a doctor, okay? a psychiatrist is a medical doctor. This is in contrary to a psychologist, who is often a therapist. A psychologist will not be able to prescribe medication, order blood tests for you, order investigations like a brain scan. They will not be able to assess your physical health, which can affect your mental health. A psychologist by themselves will not be able to admit you in hospital. So that's the difference between a psychiatrist and a psychologist, that we psychiatrists are medically trained. So we treat the whole human. I think that's what I like, right? We can't just ignore the fact that your high blood pressure is not controlled. And hence you've been having these headaches, which are making you depressed. You know what I mean? Because you are in pain constantly, you are feeling sad. And sometimes, it's just a matter of treating that blood pressure or treating that other physical condition that is contributing to your physical illness, that is actually affecting your mental health. Okay, so that's what a psychiatrist is, that's what a psychiatrist does. And the question is, what kind of conditions do we treat, right? So you are maybe thinking of seeing a psychiatrist because maybe someone has referred you. We'll talk about it just now, who can refer you to see a psychiatrist. But the kind of conditions that we treat is depression, anxiety, bipolar disorder, schizophrenia, ADHD, post-traumatic stress disorder, substance use disorders, eating disorders, personality disorders, dementias, and others, right? So if any of those is familiar to you, or anyone in your family who's suffering from any of those and is not seeing a psychiatrist, I highly recommend that you get them to your nearest psychiatrist. Okay, and the next question that people ask is, how do I actually get to a space where I can see a psychiatrist who refers me? So usually people go to their family physician or family doctor, that is their general practitioner, and then they can refer you. And I think this is the safest way to actually be seen, to see a GP first. You know why? Because usually general practitioners have a network of doctors that they work with, be it psychiatrists or psychologists, and they can refer you to trusted people. You know what I mean? And some people can go into the net and you can Google psychiatrist near me, right? And then you can read the reviews, which sometimes are accurate but not really always accurate. Sometimes someone is just angry because of many reasons, which, can we say, sometimes are really valid. So you can use that, but I think the best way to get a trusted practitioner, because this is your mind, this is your brain, right? You need to get someone who's trusted. The best way to get a trusted practitioner would be, for me, go to a general practitioner, ask them to refer you to someone, go to your therapist. Some people are already seeing a psychologist, and then you feel like, oh, I'm really struggling to sleep, I'm really my appetite is bad, my energy is low. You see, now you're fulfilling a certain criteria, maybe for depression, and it's not just mild, it's moderate to severe, the one that requires intervention, biochemical intervention in terms of medication, right? So even if you're seeing your psychologist, the psychologist can also refer you. If you're seeing a counselor can also refer you, write a referral letter to the psychiatrist. It's very important, especially talking to South Africans, a referral letter, because if you don't get a referral letter, some medical aids, especially if you're in private, some medical aids will not pay for that consultation. Okay. And if you are in state, so you are in the public sector and you are residing in South Africa, the first place you need to go to would be your local clinic. Okay. So if you go to your local clinic, they'll also write a referral letter for you to see a psychiatrist. Often there will be psychiatrists or psychiatry registrars or mental health care practitioners in the form of doctors who work in mental health, who work in psychiatry. They might not be psychiatrists, but they have vast experience, and they're actually very good because they've been working in psychiatry for a long time. So the mental health care nurse will refer you to them, because the nurse will not just start treatment without having seen you. So instead, a nurse can refer you, a social worker can refer you to the mental care nurse, and then the nurse refers you to the psychiatrist or the doctor who works in psychiatry. And then that doctor will see you, assess you, make a diagnosis, and then begin treatment. Okay, so I hope that is clear. We call that the referral pathway. And remember, if you're living in South Africa, there's two streams. There's the public and the private. And with private, often it's via your general practitioners or your psychologist or therapist that you're seeing, and in state it's via your clinics, so your CHC, all right, your community health centers, all right. I hope that makes sense. Sometimes in the state also, you can go to a hospital, but all hospitals will also require that you come with a referral letter from the clinic, unless you are an emergency. Emergencies are when people are at risk, so a risk to themselves, a risk to other, their risk to the community, like also there is a risk of distraction of property. So all of those kind of situations, you don't sit with that person at home and say, oh, we're going to wait for the morning, right? They are, they have harmed themselves, or they're threatening to harm themselves, or they're threatening to harm others. This is in the realm of serious mental illnesses, like serious or severe mental illnesses like schizophrenia and bipolar. In that case, you can go straight to a community health center that operates 24 hours, or you can go straight to your regional hospital that operates 24 hours. You don't even need like a referral, because in that case there is high risk for the individual to hurt you or to hurt themselves, and you need to be very prompt about that. When you are there, you will be told of the steps to follow so that you can get that person admitted, and often it will be against their will. Okay, so the state facility works different to the public, to the private facility, and today I want to really delve in the private facility. And next month, we're going to have a doctor who works in the public sector, and she's going to tell us all the procedures that you can follow when you have a loved one who is at risk of harming themselves, or actually trying to harm themselves. Okay, makes sense. Break time, guys. South African Depression and Anxiety Group, it's called SADAG. You can give him a call on 0800 567 567. That's 0800 567 567. If you are going through a hard time and you are having negative thoughts, especially thoughts of self-harm, this helpline is available 24 hours. There will be someone on the other side. You can even call ER24 and you can talk to them, and they'll give you the next steps on how to keep yourself safe or how to keep your loved one safe. Got it? Amazing. Okay, so back to today's topic. We are talking about what really happens in your first psychiatric appointment and why you do not need to be afraid. And we've just talked about who can refer you to the psychiatrist. And also now I want us to move to the next question, which is what happens in the consultation room. Okay, guys, you must love me for this. Okay, I love myself for this. I love this for you. Okay, we are here to debunk stigma. Okay, we are here to put a face to mental health. So now we want to ask the question, what actually happens at a psychiatric consult, like when you see a psychiatrist? You are in the room now, you've made the appointment. Remember to always make an appointment. You cannot be a walk-in, and we are addressing specifically the private sector here. You cannot be a walk-in because the appointment in itself needs enough time. So this is not something you can do over 5 minutes, okay? Your doctor is not going to talk to you over 50 minutes and then it's done. They need at least an hour, at least. Some have taken an hour, 30 minutes, or even to 2 hours. Sometimes some doctors will split it between 2 sessions. Session 1 will be information gathering, and then the second session will be further information and feedback on what the diagnosis is and the medication that you are going to start embarking on, if there is a need for medication. And it's basically just an overall treatment plan and what is the way forward. Okay, so you need to be prepared. So don't come and you're rushed. And I would say ask the psychiatrist how long is it gonna take, so that you can book the time off, from work, and you are not rushed when you're there. It is very important to prepare your mind and your heart and be open to the session, right? That's when you're going to get the best out of it. Remember, we talked about responsibility, autonomy, and self-agency. This is your healing. This is your health. Hopefully you've done the homework in terms of, the psychiatrist that you're going to see, and you've done your research before you even walked into that room. Or if not, you have a credible referral source, so that you know that you are not, going to be harmed. Okay, because this is a very intimate space between you and the doctor. You are going to bare your soul. At least you want to know that this is someone that you can really trust. Okay, so the things that you need to prepare as you come to visit the psychiatrist, I would say, 1, the referral letter, please bring it. 2, if you ever done any bloods, or if you have any diagnosis and you have any medication that you're on, please bring it along, or bring the script. The doctor needs to know exactly what medication, and the doses of that medication is very important. I would say if it's not your first time seeing the psychiatrist, this often happens. You've seen a psychiatrist before, you got better, and then now you're not feeling well again. Please just do the due diligence of going back and looking at the medication that you once took. If you don't remember the medication and your medical aid, just go ask them and see what scripts did you fill in the past. Why is this important? If the doctor is going to treat you and maybe prescribe medication, they need to know what you were previously on. Why? Because whatever worked before is probably going to work again. Okay, and what didn't work, high chances that it won't work again. But if the doctor wants to re-challenge you with a medication that did not work, or a medication that gave side effects, depending on their own discretion, they need to know. So very important to gather that information and have it handy when the doctor is asking you, so that you can get the best treatment that you need and you require. Blood results, or blood tests, or brain scans, or reports. Maybe you've seen a psychologist, a neuropsychologist, an educational psychologist. Any report that you have, it's very important that you bring it along. You can even email this prior to coming to see the doctor, so that she has it, and by the time you walk in there, she has full information of what's going on with you and what it is that you need. I hope that makes sense for you, and it sort of like helps you in preparing to see the psychiatrist. Please know what other illnesses that you have. So if you have high blood pressure, thyroid disease, kidney problems, your liver problems, if you have any of those problems, please be aware and let the psychiatrist know. Why? Because they are going to prescribe medications, and these medications is metabolized in the kidneys. Yes, in the kidneys and in the liver. So if your liver is not well, it cannot break down the medication well, and then the medication is not effective. If your kidneys are not working well, they will not be excreting, getting rid of the medication, then the medication builds up and it becomes toxic instead of being helpful, right? So you see how there's that mind-body connection. Everything is integrated. You cannot be disjointed, right? You can't say, no, that's for my GP. No, that's for my cardiologist. We need to know that your heart is working and working well, because some of the medication affects the heart. You know what I mean? So all of it is important. So all of your medical history is important. If you had a previous head injury, please tell your doctor. It's very important for them to know, because then that might be affecting the presentation that you're bringing today. Okay, this is why I love psychiatry again, because we don't just treat the brain, but we treat the whole being, because the brain is an organ in the body, and the body is connected to the brain, and the brain is connected to your mind. It's all one. Okay, I hope that is helpful to you, and you are now feeling a bit more confident in terms of what you would need to bring when you are seeing the psychiatrist. Remember, when you are in that office, the psychiatrist is going to ask you questions. It's not an interrogation, it's a conversation. And the aim of the conversation is to get to know you more and more. Okay, so it's collaborative, it's not paternalistic. So we've moved away from the system where we tell you, you have 1, 2, 3, this is what you're gonna do, go off and have a great life. No, we don't do that. We put options on the table, we weigh them, we discuss the pros and the cons in the room together, and then you go and try it, and then you come back, this is not working, what do we need to do? It's a dance. Okay, it's a dance, it's collaborative. This relationship is going to be going on for a long time, so you better like your psychiatrist. Okay, you better like them, and you better feel free, right, to be able to say, hey, this is not working. Oh, I'm feeling side effects. Oh, I don't like this anymore, right? Very important not to make unilateral decisions. Very important to do the tango, right? It's a dance. We're doing it together. It's like you've now gained a partner through life, you know, to walk with you this journey, and it's done well. I really feel like it's such a privilege and an honor for us to get to walk with people in that form, and for people to open up their hearts and trust us with their deepest, darkest secrets, like deepest, darkest parts of their souls that sometimes they're never told to anyone. Sometimes you're the first person to hear this, and for us, we hold that with so much reverence and respect, right? So having said that, you must know that everything you say to the psychiatrist is confidential. So the psychiatrist by law cannot, disclose whatever you discuss in the room to a third party without your consent. Okay, so the psychiatrist will always ask for consent if there's information that needs to be disclosed, and you need to give that consent. Otherwise, whatever we discuss is between the two of us, unless there is a risk of harm. So by law, the psychiatrist can disclose and break confidentiality if they realize that in that instance you are threatening to harm yourself or harm someone else. Okay, and even there, it will not be like full disclosure, but that information will be sort of like disclosed to a next of kin, and really it is just for your safety. And this especially, it applies to everyone, but especially to minors, everyone who's younger than the age of 18. Okay, I hope that makes sense, and you now know what you need to bring. Okay, so a summary: you need to bring all your old reports, your referral letter, previous medication history, and I love it, bring an open heart. Okay, so if seeing a psychiatrist is so wonderful, ne? Can you see it? It's really wonderful. You are there to do the tango and the dance. And remember, the therapeutic alliance. So what you build in that practice room, that is actually the tool that leads to healing. Having that healthy relationship, that is the container right? And if the container cannot contain and there's a breach in the trust and trusting relationship, then it's very hard for you to be able to get to a place where you feel like seeing a psychiatrist was helpful. Do you get what I mean? You know, if you don't get what I mean, ask me in the comments. I'm ready for the questions. Give me the questions. I love them. Okay, so we want to get to the final question. Why are people scared to see a psychiatrist? Remember, today we're talking about what really happens in your psychiatric appointment and why you don't need to be afraid. So I'm just going to look at a couple of myths, I would say, but some of them are not even myths. Some of them are like real, like this is what people are experiencing, right? So maybe let's call them barriers. What are some of the barriers to care? A barrier to accessing care, psychiatric care. And I've put here the first one is people have a fear of being labeled. People will worry, you know, that they'll be diagnosed with something serious. What if they're crazy? You know, people are always thinking a psychiatrist is going to call them crazy. What if it goes on your records and you can't find a job? And people always say this. And I think it's very important to understand that a psychiatry diagnosis, even though it can feel permanent, but it's not identity defining, right? I think some people are very happy to finally have a name for whatever they've been going through. Oh my goodness, okay, so other people go through this, so it's a relief. But for some people, it can feel like, oh my goodness, do you mean that I'm cuckoo? Do you mean that? And I don't like those terms because that is self-stigmatization and that keeps you stuck, okay? So, don't look at it as a label, but look at it as a way of gaining self-awareness. And now we have a name. Because we have a name, we can categorize it. Because we categorize it, there is a way, there is proven scientific treatment for it. You know what I mean? That's just what we are doing. It's not really who you are. That's why we move away from terminologies like you bipolar, you schizophrenic, you know, you depressed. You don't want to own this as an identity, but you want to see it as something that you sometimes suffer from, right? So that you can, you know, cause that separation and be able to treat it as such and still retain your sense of self and sense of agency. Okay, so stigma, I've already alluded to this. This is internal and cultural stigma, especially, you know, we live in Africa. And we think we don't believe in these things. These are white people things. And even if you are a Caucasian and you do suffer from mental illness, culturally in some spaces, that is not welcome, right? It is frowned upon. You know, in faith spaces, I remember when I decided that I was going to do psychiatry, people in my previous faith space said to me, oh my goodness, you're going to treat demons now. Imagine the ignorance, right? So some people fear seeing a psychiatrist because of just the stigma that can be cultural, but also internal, right? You internalize all the cultural stigma and you stigmatize yourself, right? You feel like you are weak, you lack discipline, or some people in the Christian spaces will say they're having a spiritual attack and they don't need to see a psychiatrist. Sometimes there's a lot of shame and self-blame attached to it, so you tend to stay away from actually getting help. So we're talking about barriers to actually accessing psychiatric care, fear of medication. A lot of people have this perception that psychiatric medication will change how you are. You'll become addicted. Once you start it, you can't stop it. It will make you numb like a zombie. Oh, I can see the parents of ADHD kids right now. No, this medication is making my kid to be a zombie. And I'll give it to you. You know, people have different experiences of the medication, but what we do know for sure is that you will not be addicted to this medication. It does not cause addiction. I think people confuse psychiatric medication with sedatives or substances that impair functioning, and it's not. Yes, sometimes when you do take the medication, a doctor can use a sedative, but it's only for a short time, and it's usually it should be a controlled period of time and not for a long time, unless it's an exceptional case. And even in that case, the psychiatrist has probably gone through all the pros and cons with you. So a fear of taking medication, you would take medication if your heart was failing. Why wouldn't you take medication if your brain is deficient of some chemicals? And of course, this is me really simplifying it. We know that it's more than that. But when we look at seeing you as a psychiatrist for the first time, we talk about the biopsychosocial approach. So biological, psychological, and social. So biological talks about all the biological markers, including neurotransmitters. And of course, there's many discussions and debates that are there in terms of biologically what causes mental illness, and now we can go into this some other time. But it's very important to note that medication does play a role. It's not the only tool to use, but it is one of the tools that we use. And I would say let's debunk all the stigma around medication and even the myths around medication. So another reason why people tend to not come to psychiatry, they feel like they're going to lose control. I think initially we talked about people coming to public hospitals who they are admitted involuntary. They can feel judged. They lose their sense of autonomy and agency. They feel like their secrets will be exposed. You'll be told that you are not coping. So this is especially prevalent in high functioning professionals, because now all of a sudden I'm seeing a psychiatrist, people will really think that I don't have my acts together. Can I tell you something? No one has their acts together. No one. We all pretending like we have our acts together. We don't. We all making the best out of what we have. Okay. Another barrier is fear of being seen as weak. And again, this is the helping professions. We all want to white knuckle it. We can do it. We're strong, especially women. We're strong women. No, it's okay to be soft. Softness is also a form of strength. Water, very soft, but it can carve rocks. Okay, so let us also embrace softness and be open to be helped as well. And some people have had previous bad experiences, maybe with family or just themselves. They felt rushed, they felt unheard in the consultation room, they were over medicated, and that's a thing. They had bad side effects from the medication. They felt very dismissed by clinicians. I'm sorry, it's us, we do it sometimes. Please forgive us. I think there's so much we can talk about, but yeah, sometimes psychiatrists in their human nature do not show up as their best selves in the consulting room, and that can leave a bad taste in other people's mouths, and they never come back again. But then you are suffering. I just say, if you didn't like that consultation, just go find someone else. There are many other people out there. Make another appointment with someone else, because the relationship is a therapeutic tool. If you don't get along with your psychiatrist, it can be very hard for you to access the right kind of help that you need if you're always feeling judged and not feeling seen. Okay, there can also be financial anxiety. Let's be honest, seeing a psychiatrist in South Africa is very expensive, and I know so also in other countries. So some people will say private psychiatry is too costly, it's not worth it. I should be able to handle this by myself. Why do I need to see someone? That kind of thing. So that ends up being a barrier to actually accessing care, and this is a public mental health issue that we really need to talk about and try to come up with solutions. So I think those are very important reasons. And then the last one I'm going to talk about is just religious conflict. Some Christians think that if they pray harder, they shouldn't be needing this. Seeing a psychiatrist, a psychologist, means that you don't trust God. They are taking the place of God. And I want to talk about this, about spiritual safety. And this is why I'm very passionate about the integration of faith, spirituality, and mental health. Because some people are very serious about their faith and they feel like, oh, if this person is not honoring of my faith, I will not see them, right? They're making fun of my faith, so I will not see them. But I would say, just do your homework in finding someone who's going to honor your faith. But all psychiatrists should be culturally sensitive and spiritually sensitive. So you should be sensitive to your faith. It is part of our assessments, and one of the questions we're asked, like, what is your religion? What do you believe in? And what role does religion play in your life? So most psychiatrists, properly trained psychiatrists, will honor that. Of course, we don't turn into a pastor in the room, but we sort of like encourage you to use healthy tools that can help you heal better. Okay, so I think I'm just gonna end there. There's more, but I think let's end there in terms of the barriers to care. And just to say, people really are not scared of psychiatry. They are scared of being exposed. They are scared of being seen. And I want to say to you, friend, be brave and allow vulnerability. Okay, that's the only way we can heal. And know that to deal with these fears, you must know that the intention behind every consult is to help you yourself to understand yourself better. Remember, everything is confidential. Remember, you are free to ask questions. This is about your health. Be courageous enough to be vulnerable. Okay? And I'm going to conclude and say healing requires you to take responsibility. And often when you leave a psychiatrist's office, you leave with a prescription. Honor it. And don't stop any medication without consulting a doctor. Don't make unilateral decisions. Remember, this is a tango. This is a dance. Let's do it together. It's collaborative. Talk to a psychiatrist. Ask questions. Send an email. Call. Do all the things. All right? And remember, your mind matters. Your health matters. And seeking help is not failure. Seeking help is not failure. It is responsibility. You matter and you deserve to live a wholesome, flourishing life. Until next time, guys, please remember to subscribe, like this video, send it to a friend who's maybe afraid to take this next step, and and hopefully it can allay any fears. And please comment down below with all your questions around this topic. Comment on social media. Really love to hear your questions so that we can address them appropriately. Until we meet next time, friends, please have a lovely month of May and keep flourishing till we meet next time. Bye bye.